It's a stressful time for moms, especially because on top of making sure they can feed their kids, they also deal with constant questions like this one we got in our voicemail inbox this week.
Why has no one suggested that these ladies that can't find formula breastfeed the babies?
Okay, so it won't surprise you that yes, that has been suggested before. A lot of mothers do breastfeed, but many do not for perfectly good reasons. So joining us live now is Braun, a certified lactation consultant at the Care Connection Lactation and Wellness Center here in Western New York. Thank you for being here for our town hall. You work on helping women with breastfeeding, with their journey, but in the end, are there some obstacles, and can you just talk about those that aren't going to make it realistic for some women to breastfeed?
Most women are biologically able to breastfeed, but ideally they're going to be starting right in the hospital shortly after delivery. It's much harder to start a milk supply when a baby's a month old or older. Ideally, moms start thinking about how they're going to feed their baby right while they're pregnant, prenatally, maybe in a conversation with their OBGYNs. It's hard to make those decisions once you've had a baby, you're tired, you're overwhelmed by hormones, you're overwhelmed by the responsibilities of being a parent. So going forward with moms that know they're going to be delivering in the next few months, and we don't know how long the formula shortage will go on, please consider breastfeeding. Ask for help right away in the hospital. There are lactation consultants in many of the hospitals, and that can make a big difference. For moms that had no idea this formula shortage was going to come up, don't blame yourselves for not breastfeeding. Hindsight is 20/20. Babies do grow on formula, but in the past 20 years, there's been so much more research about breastfeeding, and we found out it has so many health benefits really for babies, moms, society. And so there are a few situations, medical problems for either the mom, the baby, or both, where breastfeeding just isn't going to work. But in the vast majority of cases, if moms try to breastfeed, it will work if they get the right support and education.
That's so important. Now, what's the impact of the societal pressure on these women? Because that voicemail we played was a lot, and there's also a constant stream of comments on social media, just people pressuring women to breastfeed. So how do you help women deal with that?
People do the best they can with the information that they have and the resources they have. If moms have certain medical problems, it may not work out. And so the most important thing, of course, is to feed your baby. And there's so many parenting decisions that need to be made, and only the people in the trenches, the parents, the mom, can make those decisions knowing all the factors that interplay with their lives. Moms sometimes have a death in the family, or they have absolutely no support, or because of financial reasons, they have to go back to work way too soon. Sometimes I've seen moms return to work really within a month, and moms need time, support, education about breastfeeding in order to feel comfortable and confident doing it. And so that's why a place like ours, the Care Connection, can offer that education and support that moms need. There are other places to look as well. The WIC program, hospitals, your own pediatric offices, but just to know that there are resources available and get help early if you run into any difficulties with breastfeeding. It's a natural but learned experience for moms and babies.
And let's talk about some of those resources that you offer. If somebody contacts you, what kind of help can you give them?
There are several internationally board certified lactation consultants like myself here at the Care Connection. And we do have virtual appointments, with Zoom meetings. We offer phone consultation, and we offer in-person visits 6 days a week. So there's plenty of help available, and don't be afraid to contact us. Many insurance programs pay for a lot of our services in terms of the education and support we give to breastfeeding moms. And getting intervention early can make a big difference in terms of how comfortable you feel with breastfeeding, how comfortable you feel with your baby's weight gain.
It's so important. Thank you so much. Braun, a certified lactation consultant at the Care Connection Lactation and Wellness Center. Thank you for being here for our town hall.